Franklin County Commissioner Kevin Boyce. It's Wednesday, it's 3 o'clock, and so you know what that means. A brotherly conversation with Commissioner Boyce on health, wealth, and race in Franklin County. I'm really excited today. I've got two very special guests with me that I think you're going to really want to be engaged on. So much happening today, so much in the news, so much going on in our lives. But today, we've got the people who make the decisions about the COVID-19 environment we're living in. So, with me today, two of my favorite people in all of the world. First, I've got Dr. Mysheika Roberts, and I'm so excited to have you with over 18 years of public health background at local, state, and national levels. Dr. Roberts has been the health commissioner for Columbus since 2017. Prior to being named the Columbus Health Commissioner, she was a medical director and assistant health commissioner at the Columbus Public Health Department. I remember those days when you were the backup, when you were the number two there. Now you're the number one. Of course, over the course of her career, she has led initiatives for the Centers of Disease Control and Prevention and the Baltimore City Health Department. And so, Dr. Roberts, as always, it's such a wonderful treat to have you today. I'm sure there are just so many people who have so many questions for you. I know I do. So anyways, so welcome. Glad to have you.
Glad to be
Looking
here.
forward to the conversation. And then a guy who, fortunately or unfortunately, I don't know, it depends on how you want to look at it, I have to talk to every single day, Franklin County. I have to hear from this guy, and he's given us death toll numbers, and he's given us the spread numbers, and he's given us safety provisions and different things. And we hear from him every morning at 9 a.m. So I say pleasure or not a pleasure because sometimes it's bad news. Nothing to him personal. He's really a nice guy. But Joe Mazzola is with us, and since 2017, Mr. Mazzola has served as a Franklin County Health Commissioner. Prior to that, he worked at the Ohio Department of Health. He serves as a member of the Governing Council for the Ohio Public Health Association and chair of the Shared Services Subcommittee for the Public Health in the 21st century with the Ohio Public Health Partnership. He is a 2015 recipient of the Association of Ohio Health Commissioners President's Award. I don't know what that means. It sounds fancy. It sounds good, and I'm sure it is. But we're grateful to have you, Joe. Welcome to our brotherly conversation.
Thank you, Commissioner. Good to be with you. Good afternoon, Dr. Roberts.
Good afternoon.
Now, you two are acting like y'all don't know each other. Like, good afternoon, Dr. Roberts. Good afternoon. I'm sure y'all talk on a regular basis. Yeah, no, maybe.
Talk, text, email.
Okay. Yeah. So don't try to act all like y'all ain't, so serious and all of that. Let me just start off with a question I really like to ask my guests because 2020, no matter where you are, no matter what your job, title, or role is in this community, 2020 has been the year. It's been an interesting year. And you as professionals who have really been, I would say, maybe neck deep in all of this since the very beginning, probably even since before it really hit us here. We started off with all of the global pandemic urgencies, and then there was the unfortunate tragedy of George Floyd that really brought to the forefront this conversation around racial disparities embedded in health. And now we're dealing with an election cycle that is really wired up and everything. And so, if there was one word that you would use to describe just how 2020 has been for you, what would that one word be? Now, don't try to give me some medical term either. Don't try, just, we want to know like what the one word is, like if it's good or bad. I can tell you, I've heard words like exhausted, tired, anxious, excited, hopeful. I mean, you name it. And folks have really kind of laid it out. But I'm curious, what would your one word be to describe 2020 for you? Dr. Roberts, why don't we start with you?
Wow, that's a good question. It's hard to say in a word. And I love your expression about neck deep. I always hear knee deep in something, but neck deep. I definitely feel like I could even be forehead deep in this.
Right.
But my one word to describe 2020 thus far would probably be Unforgettable.
Wow. Unforgettable. Interesting. Interesting. Hmm. Joe, what's your word?
Well, I was,
And you
as you
can't
were,
use her word either.
I'm
So you
not going
can't
to use
you
her
can't be like,
word.
yeah, unforgettable is my word
That's
too.
it. That's the one. No, I was going to say unexpected. I don't think, as we kind of walked into 2020, even as we kind of heard what was happening across the globe, I don't think we could really have appreciated what was going to happen here locally. So I would say unexpected, and it's been a year of twists and turns. So for me, that's the first word that came to mind was unexpected.
I mean, yeah, those are good words. Unforgettable, certainly, and
Mm-hmm.
unexpected, also. And I think that's interesting coming from a person who is in the medical field here, in the health, public health field, rather. And because it seems like to me, as public health leaders, you kind of always have to expect some kind of public health crisis, right? Isn't that what you're trained for? Isn't that really what public health is, the anticipation of and the management of these kind of health crises, no?
Well, absolutely, absolutely. We plan for all sorts of contingencies, and we do that regularly. And that's one of the core functions of public health is emergency preparedness and planning. But I think the way that I sort of thought of that, one word was, as we come on the heels of 100 years of public health and, kind of the impetus of where public health has gone, I don't think we really could have foreseen something like this, as we close out 2019. But absolutely, I mean, we absolutely plan for emergencies all the time. So it's core. It's a core function of what we do.
Dr. Roberts, you were going to add something to that?
I mean, I would agree. We plan for it. And I think we plan for the public health response. And with this pandemic, what at least I know I was not necessarily thinking about is the worldwide response, thinking about, borders being closed, thinking about businesses being closed up. The schools being at home is something I think we all kind of knew was a possibility in some of our plans. But some of the other industries that had to close and the businesses that have been lost as a result of this pandemic and the worldwide impact of this pandemic is something that in our planning, I think we were so focused on the public health response that we didn't really take into consideration the impact of all those other factors and how that would impact the public health response.
I mean, you really raise an interesting point of discussion, and that's, I was going to say this for later, but let's just dive right on into it. I mean, and that's the economic implications. And at some point, you as health professionals, as public health professionals, you're really charged with protecting all of us. And at some point, we got to this point in this conversation where it was public health versus the economy, if you will. And so how do you all feel about, and I know you're in these positions where you don't want to get into the politics of all of this, the politics of all this, but you're in this position where, quite honestly, let's just call it like it is. Let's call it like it is. I'm just going to be, I'm trying to protect these two, but I don't have to be protected. I can just say what I want to say, so I'm gonna just say it. I feel like there have been decisions that have been made that are not so much based on the science of protecting us as a community, but based on the need of the economics that also have implications. But I think that's been driving the quote unquote second half of the game, if you will. How do you all feel about that? What do you agree with my statement? Do you not agree? Do you want to defer? You want to work around that to some other kind of answer? Just however it is. But I want to get your reaction because I know that's been the divide out there. There are some people who feel like I need, the economy is the core to our, happiness and our wellness and all these things. And then there are some of us who are like, well, I want to live and I want my family to live and I want us to address this pandemic, and I will suffer, a little bit financially because of it. But what do you all agree with that? Disagree? What do you think? I'll just let you all decide who wants to go first.
I will say that you're absolutely right. As a nation, we definitely made some decisions. And I think what it revealed to me is where our country's values were. And when I looked at other countries and how they responded to this pandemic, and in some instances, in most instances, they lost less people as a result of COVID-19, but they also maintained their livelihood and their businesses much more so than we did. So their governmental response to this was much more unified and much more holistic than our response was. And when I say our response, I really am referring to the response that happened from the very top down to the bottom. So the national response. And in some ways, it really revealed what those of us in public health have always said, that we always feel like we're the low person on the totem pole, we're the least funded. And, some of that became apparent in our response, not necessarily here locally, but definitely across the country, because we were the low people on the totem pole. We weren't funded appropriately. And so in many instances, there wasn't the infrastructure to respond to this type of pandemic. And we saw that here, even in the state of Ohio, as strong as our leadership has been in the state and as much guidance we've gotten in the state, we have a database at our state health department that, some of my staff like to say is older than the iPhone. And, some of us might not say, well, when did the iPhone come out? But the point is the technology has changed so much in that time. And the database that we are all mandated to report to is very ancient. So ancient, we can't pull some basic information that you as an elected official and your constituents want to know. We have to pretty much, I mean, it's not literally, but it's almost like hand tallying some of the information that you would want to know or the constituents would want to know, because the database we're using is that old, that antiquated, because of poor funding, years and years and years of poor funding. So to me, what this pandemic revealed is really where some of our values were, not so much of what we have invested in, but also what we haven't invested in. And we saw that as well when we saw some of the disparities, what we failed to invest in as a country. We saw the disparities in those who were dying and those who were suffering from this disease.
And we've just got to do better. We've got to do better as a country. And I mean, you really set this up in the right way. And I'm going to go to Joe here in a second. But you said it. You started off your statements by saying it's a value system, and that value system is the most important part of this conversation. When Franklin County and I know our health commissioner here for the Franklin County led the way in a lot of this conversation around the declaration of racism as a public health crisis. That's a value proposition. It's one thing to say it, and it sounds like something that gets your attention, and it's a very logical and understandable perspective. But at the end of the day, it illustrates where our values are. But what really tells the story is then what we do thereafter. How we make decisions, how we prioritize. And you summed it up in the best way I could see it. And that's that we're not funding our public health system in the right way. And here's one of those systems that protect everyone. They protect everyone. This isn't a situation where, well, the East Side's going to get this and the West Side's going to get this. Public health, by nature of its design, is designed to protect the public. And so I think it's something that really deserves a deeper dive and a question at our legislature, in our Congress, and even, yes, at our county commissions and our city councils. This is something that I think we're at the very beginning of a new chapter, because I know for myself as a commissioner, after the pandemic is over, I want us to look at not just what's mandated for what we have to do with public health, but what's best for what we have to do with public health. And that's why this conversation is so important. But Joe, maybe you want to shed some perspective on it as well.
Well, I think just to build on some of those points, I think this pandemic has revealed a couple of things. It has definitely revealed a long-lasting underfunding of public health. And I think Dr. Roberts gave a couple of great examples in terms of our infrastructure, our IT, and some of the systems that we have to work in. But I think more broadly, it's revealed some the fact that public health is interconnected with everything that we do in our lives. We talk about a public health system a lot. Our public health system is not just the two health departments. Our public health system is our schools, our employers, all of the social service agencies, our healthcare providers. We have to always think about public health, in my opinion, in that context. We have to think about how do all of the other systems that support those social determinant areas that we talk a lot about, how do those kind of connect? And I think what really has been revealed in this pandemic is when something like this happens, how many people are vulnerable from an economic standpoint, from an education standpoint, from a transportation standpoint, from a basic needs standpoint, utilities, et cetera. So I think if anything, what we have seen firsthand over the last 6 months is just how connected our public health efforts are to the to our entire society. And I think when we see things, when we have kids learning remotely, or when we have thousands of our residents now out of work, and other examples, I think it just sort of reiterates this idea that everything we do in public health has a connection to other sectors. And we need to always think about public health from that standpoint.
Yeah, I mean, and there's really not any area of life that you're not interacting with public health. I mean, and I want the folks who are watching to know that, whether it's a disease that's spreading, I know that public health is sort of charged with tracking TB and tracking, hepatitis and different diseases that still are very prevalent in our society. And tracking them allows you to manage the spread better. And so I want you to talk about that in a second here, but let me give a quick shout out to Meredith Lawson Rowe, who's watching out there, Reynoldsburg City Council. I'm telling you, Reynoldsburg City Council, those folks are doing big things. It's so good to see you, Meredith. Thanks for joining us. And she says specifically, she wants to give a shout out to both Dr. Roberts and Mr. Mazzola for their work regarding racism as a public health crisis. And so she wanted to say that publicly. So thank you, Meredith, for that. Kelly Johnson with the Franklin County Office of Aging. Thank you so much for joining us. Jonathan Bentley, Jonathan from Youngstown. Jonathan watches every week. I appreciate you, man. I like, at least I got one viewer. If you got one, then you tell, you can spread it out. So, hey, if I got one, I got an audience. So thank you so much. Ariel, Sal, thank you so much for joining. I hope I said that's my niece, but that's her married name. So I don't know if I'm saying that right. But Ariel, thank you so much for watching too, my lovely niece. And then Ari Tolles, thank you so much for joining us. We've got the health commissioners, the health directors from Central Ohio on the line right here. And this is really great for the conversation. A lot of the public, one of you mentioned data earlier. How much of your decisions, how much of your planning, how much of your strategy is built on data? You all know 2020 is a census year, and we are collecting census data as we speak. We are coming up on a deadline. You're here real shortly, but maybe can you both talk about the importance and value of census data? Dr. Roberts, you had talked about being underfunded in public health. Talk about that for a second and how that's connected to the population data that we know that we only get one shot at every 10 years, and how that drives your decision-making, your strategy, your planning for this health district.
Sure. So I'm glad you brought up the census, because I tell people there's a few important things they need to do in 2020. One is complete the census. The other is vote. And then obviously wear your mask, stay 6 feet apart, wash your hands, and stay home if you're sick. I have to throw those things in too. But we are funded as public health departments across the country, but especially here right in Ohio. So much of our funding is based on our population, how many people we have, and how many people live here at certain income levels, and the demographics of our community. And so if we don't appropriately fill out that census form to know that and get it back to the feds, Ohio, Franklin County, and Columbus could lose out on federal funds moving forward to help those populations that are in greatest need of not only public health services, but all other services in our community. And so we rely on individuals to complete the census. And then we rely on the data because it does help us drive many of our programs. The data is part of the science. It's one aspect of the science that we look at. We closely look at the science, how this disease is transmitted, but we also look at the data, which demographics are affected, which age, which zip code, and try to make sure we are providing services, providing education, and providing intervention in those areas or those populations that need us the most. And not only with COVID-19, I mean, a great example that both health departments are working on is with infant mortality. And, so we need to know how many children above the and below the age of 1 are living in which zip codes, how many pregnant women or women of childbearing age are living in certain zip codes, so we can make sure they have the appropriate services they need for their stage of life.
Well, and there are also racial implications when you start to look at data and you start to try to really prepare, plan, and understand what you're looking at. Because sometimes even zip codes can often be illustrations because people tend to be around people that look like them, and so sometimes you see it, but not always. And when you're starting to compare and contrast data, sometimes it's helpful. When you'll start to see racial implications come out, and that's why in areas like hypertension, diabetes, obesity, you can start to connect the dots on access to food, access to fresh foods, transportation, parks. I mean, all of these things become data points that are relevant to folks like myself who are in decision-making roles that allow us to plan for our community, like you all have to do around public health. Joe, what's your perspective on that? I mean, you maybe you disagree with Dr. Roberts.
I do not disagree with Dr. Roberts. And for public health, everything starts with data and assessment. It's one of the core functions, again, that we're responsible for as a health department. And with both health departments being nationally accredited, we couldn't have achieved that without a proper community health assessment. And that's not just secondary data, but that's primary data too. It's going out into the community and understanding what our community needs are, what are the beliefs, the attitudes, what does our community really, how do they view their health? So kind of taking all those data points, looking at things like the built environment, overlaying all of that, really providing that context for our health. It all starts with putting that comprehensive assessment together so that we can inform our community health improvement plan, which both health departments have as well. And I want to just mention that as we're kind of looking ahead, both health departments as well as our hospitals are now collaborating on our next community health assessment. So it will be an even more complete picture, if you will. And I'm really excited about that. I think it's going to be a very beneficial process for our community. It's going to really look deeply at not just public health data, but healthcare data and other data sets that maybe we haven't traditionally been able to bring into that picture. So it really is, it's critical. And it's a core function of what we do. And we need to base a lot of our strategies on the, those particular assessments. And for us, again, at our health department, looking at our health jurisdiction, we serve 41 local jurisdictions. So townships, villages, and cities. And as you look across Franklin County, each one of them is different. And so we have a responsibility to put an assessment together that's responsive and it really illustrates, what's happening at that local level so that we can best serve that particular community.
I mean, and the bottom line is, Dr. Roberts, you're going to add something?
Well, I was just going to add something about data, particularly for your viewing audience, about it's not just the data, but it's also how you interpret the data. And so one example that I just think your audience would appreciate is you talk about data and we want to know demographics. And so early on in this pandemic, we all knew that there was a disparity. There was a disparity of people of color were disproportionately affected by this. And what we found from talking to some of our hospital providers, particularly our healthcare providers, was, they were seeing that there were a lot of African Americans who were coming to the hospital with COVID-19. But when they really looked at the data and studied it some more, they found out that a lot of people who were coded as Black or African American didn't speak English. And so we were looking at individuals who were non-English speaking. And so we have to really know how to interpret the data to make sure we provide the right services. And I know, for some of our healthcare systems, as well as for local public health here, Columbus and Franklin County, we learned there were pockets in our community who might be identified as Black or Brown, but they didn't speak English. And we had to figure out how to provide services to them that they can understand and that were culturally appropriate for them.
I mean, I think that's such an important point. And Charlita Tavares was on a few weeks ago, and she brought up cultural competency that we just need to embrace better as a society. We are a diverse society. We are a nation of immigrants, plain and simple. And how you look does not tell your story. Pardon me. How you look doesn't tell your story, and so it's so important that we start to embrace principles of cultural competency, where that type of assessment, that's something that can be avoided. And there are ways that we just need to understand. And you go back to what you said earlier, Dr. Roberts, and it's a value proposition. And if that's who we are, that's important to us, then we will incorporate that in the things that we do in delivery of our service and our jobs. I got to say about this census thing, though, because I don't want to, we're running up on the deadline, and I'm concerned. Right now we are currently at a 67, almost 68% of respondents, and it's just not enough. We need everyone to go to my2020census.gov. That's my2020census.gov and fill out your census form. If you don't have access to the internet, you can call 844-330-2020. That's 844-330-2020. Over 34 billion, that's what it be, $1 billion comes to Ohio to allow us to address things like healthcare, transportation, education, housing, you name it. These are things that really define the quality of life for not just you, but for being in Central Ohio altogether. And so why would we miss out on this? And then finally, I'll say about the census, it determines how we're represented in Congress. And that number is critical. Ohio, for those of you watching and don't know this, Ohio has lost congressional seats over the last 2 decades because other states are growing at a faster rate than us. And right now, we are in a battle with states like Georgia, North Carolina, and other states I know that are in that sort of southeastern quadrant. We're in a battle for positioning, which means they could pick up a congressional seat, which means we lose a congressional seat. And so places like Texas and California, they're always growing. They got 100 Congress people, and they're always growing. They're always, not 100, but they got a lot. And so there's states that are growing really fast. And so we need you to fill out that census because it matters for your quality of life. It matters for us to be able to deliver our jobs and services to you, Central Ohio. So anyways, all right, now we got our first question that's come in online. And this is from Tamika Vincent Reed. Thank you, Tamika, for joining us today. Really appreciate you sending a question. Tamika asked the question, and it's not to anyone directly, so just whoever wants to respond, you can respond. It says, how can we advocate for appropriate funding and policy changes in public health to ensure sustained focus, building systems, and quality of care post-COVID-19? I think it's a great question. Who wants to take that first?
Well, I can
be that teacher. All right, Joe, it's on you.
Okay. All right.
Start calling on people.
All right. Well, so long story short on public health funding, it is fragmented and it is unequitable. It places a significant burden on our local communities to fund. And so from a state perspective, we only receive 35 cents per capita for state funding for general revenue for our local health departments. And I'm ballparking that. But when you compare that to the fact that
I want to explain something. 35 cents per capita is population. That means, folks, that means the census count is directly related to funding for how we protect you in public health. I'm sorry to cut you off. I just want to make that point.
Love that. Yep, absolutely. So when you think about that, 35 cents or thereabouts per capita at the state level, our local jurisdictions, it's about almost $9 per capita that they invest in local dollars to pay for public health. So when you think about that, and that's just here in Franklin, at the Franklin County Health Department, we have colleagues across the state that number varies significantly. It could go in anywhere between $6 to $30 per capita. So my point is is that we have a broken public health financing system in Ohio. So to answer the question, I would say that, we absolutely need to educate our policymakers on not just what public health does, but how public health is funded here in Ohio. And I love that statement. What is the value that public health brings? And now that we've seen that value and its importance right here in front of us during 2020, how is that going to influence how we fund our public health system for the state? And that it needs to be a state and local conversation. And so I would just say, become involved and certainly talk to your policymakers. But it's a complicated formula, if you will. I mean, it's something that we've been talking about for a very long time in public health and have not been able to really get a whole lot of traction on. But certainly it's something that we will continue to stay focused on, because our residents, not only here in Franklin County, but our residents in the state of Ohio deserve a public health system that is responsive to the needs of our community.
And Joe, I'd argue that it's not that complicated. I think that and especially post COVID-19, because one of the maybe silver linings in this 2020 COVID-19 experience has been the exposure of just how vulnerable we are in the public health space. And so, Tamika, you asked the question, what can you do? You can advocate to your state legislator. You can advocate to your state senator to say, we need more funding in public health. 35 cents per capita, 35, that means you, Tamika, that means you would, for your public health effort, the state's given us 35 cents to make sure you're safe, to make sure that your family is protected, to make sure that whatever is being spread out there is not being spread to you and your community. And so you get 35 cents for that. I don't know about you, but there's not much you can do with 35 cents these days. And then we at the local level, we pick it up. He said $9 per capita, but that $9 is being taken from somewhere else. And so we need to do more. The state needs to do more. And we need to hear from folks like yourself, Tamika, not so much the Board of Commissioners, but your legislature. Those were the big dollars, or even Congress. I think that after things settle down, the vaccine hits and you got the distribution process and all that, I think that there's going to be room for a real discussion around how prepared were we? How strong are we to handle the next pandemic? These diseases, these viruses will mutate ultimately. And so, even when we're out of the water, we're not out of the water. And so we really need to have a conversation about this funding issue that's real. And Tamika, you can be an advocate for that. Dr. Roberts, you want to add anything to this? You brought it up earlier, actually. You were the first to raise it.
So, I would just say that, just to remind the audience what the role of public health is. And so COVID-19, I don't want people to be mistaken. Public health is not the entity that closed schools. Public health is not the entity that closed businesses. Public health was charged with enforcing those orders, but we were not the entity that did that. So what is the role of public health? The role, as you described, Commissioner Boyce, is to reduce the spread of the virus. So when we identify a case of COVID-19, to interview that person, to have an understanding, try to get an understanding of where they could have been exposed, and then notify their contacts so that hopefully they won't spread the virus. And if possible, we can catch the disease sooner than later so they won't spread it to others. But the other roles public health does is whenever you go out to eat outside of your home at a business, public health is protecting you by making sure that food operator is functioning appropriately. Public health is also the entity that invented the seatbelt, that invented the stop signs, that invented vaccines. I mean, that was all under the guidance of public health. So I don't want people to think about all the bad things, because right about now, people view public health as the bad guy, because they think we're the ones who are making you wear the mask. We're the ones that are telling you to stay 6 feet apart and not have mass gatherings. And that's the science that's telling us that. And public health is enforcing it. But public health is here to protect you. And we do a lot of other things outside of COVID-19 to protect you every single day. Mosquitoes, when you go to the park, so that you're not bitten up by mosquitoes in the summertime, that's public health that's out there doing mosquito treatment so that you don't get bitten in a public space from mosquitoes.
That's crucial because I can't stand mosquitoes. Man, I'm serious. That's crucial. And I thank you all for that for real because mosquitoes are like the worst. But you said something. I really just kind of go back to Dr. Roberts, and I like the way you put it earlier. Like these are important things: census, vote, mask up, stay 6 feet apart, and stay at home if you're sick. So let's talk about that for a second. Let's just zero in on the science, if you will, because people will get to talking, and people are relying on what's in the newspaper and on the. But now we get to hear from the practitioners, the folks who really understand the science and follow this for a living. And so talk about what wearing a mask actually does for us. Can you talk also about the 6 feet radius and what that really means? I'm often, I was at the grocery store one day and this lady starts yelling at me that I'm not 6 feet from her, and I'm like, and here's the funny part, but I got to tell this story. So I'm at Giant Eagle and I'm in line, and you know how you got the little dots where you wait on the dot, and now they kind of go back into the rows because it's 6 feet apart. So I'm at my little dot. There's a lady in front of me, and she goes to the next open register, which it was self-serve or whatever. And so I move up and I'm waiting, but it's kind of like still in the aisle. So as she leaves and I go to that register, this lady darts in front of me from nowhere and takes my register. And so I just the other one had opened up too. So I just kind of walked around her to get to the other one. And the lady behind me went to the next one. And the lady starts yelling at me, 6 feet, sir, 6 feet. You are violating my rights. And I'm like, and I was like, well, I said, actually, you cut me off because I had been waiting in line to get in. She called the police officer over. And the police officer's like, what's the problem? And I'm like, and she's yelling that I'm not 6 feet apart. And it was, but not for the lady at the other register said, no, ma'am, you cut him off. He was in line with me. I was in back of him and you dashed in front of him and he just went around you. And that's how he ended up not 6 feet apart. Anyways, but talk about, I know I'm going to get some message box on that. And so just come on, I'm ready for it. Just come on with it. But talk about this whole 6 foot radius, what the mask really means. And then, if you got allergies going, should you stay home? Do you not know that it might be COVID-19 or you might, be asymptomatic, but you got allergy? I mean, should you stay home then? So 6 feet, so mask, 6 feet and stay at home.
Well, to respond to your experience, everyone should remember that it's 6 feet for more than 15 minutes. So the few seconds it took you to pass this patron in the grocery store, I'm sure was not 15 minutes. So
definitely, I wish I had known that because I would have started yelling that, no, you need 15 minutes. You need 15 minutes.
Right. So it's 6 feet. And, that's what the science is telling us today, because respiratory droplets of this virus can go that far. But again, if you're wearing the mask, it does help protect that because you've got a barrier in place. So when you're breathing, when you're talking, if you have the mask on, now you've got this barrier in place. So those respiratory droplets have a harder time escaping the mask and going past the 6 feet. It doesn't mean that if you're wearing a mask, you should be really close to people. We should still keep some distance from people. We need 2 levels of barrier. So the mask is one, the spacing 6 feet is another barrier. And again, that's all based on the science that we know today. This is a novel virus, meaning prior to December, we've never seen this virus in humans. So a lot of it we're learning as we're going. So I don't want people to be frustrated that, well, why didn't we know this in April? Or why didn't we know this in July? We're learning because this is a new virus that's just now started infecting humans just in the last 9 months. And we are learning as we all experience this. And in terms of staying home, what I tell my staff.
And I would say too, I got to add this too, because now we're at the point where when you're in the store, if somebody sneezes, it's like, I mean, we all look at, or if you got a cough, you get nervous about, I don't want to cough, and these people are going to like run me out of here and everything. So, there is something to be said about when you really should stay at home. What are the signs? I mean, and so again, is it just the cough that should keep you home?
Well, I think it's a constellation of symptoms. It's not just one. And you have to know your body. So if you get allergies every September when the temperature dips below
Mhm.
70 and your allergies consist of runny nose and itchy eyes and some sneezing, and it always hits every September whenever the temperature drops,
Mhm.
then you should feel comfortable continuing to do your normal activities. But if this time it's a little different, it's a little more bothersome than your normal
Mhm.
allergies, your throat's a little itchy this time, and your throat's not usually itchy, then you should stay home until you at least, feel it out. See what happens over the next 24 hours. Do your symptoms get better or do they get worse? If it's COVID-19, chances are in the next 24 to 48 hours, you're going to see a difference in your symptoms. Either you're going to see another symptom come on top of that, or the symptoms you have are going to get worse. And so it's really important to know your body and know what's normal for you, and really try to, tease that out. Like, yeah, I always get allergies this time of year, but this time I am sneezing, or
Mhm.
this time I'm coughing. And I usually don't cough, I usually just sneeze and my eyes itch. But now I'm coughing. Well, that's new, that's different. So you need to have that evaluated. And if you don't want to go to provider to have it evaluated immediately, at least stay back, stay away from social activities, stay away from work if you're going into the office, just to see how your symptoms go for the next 24 hours or so, and then assess whether you need to go see a provider, go get tested, and figure out what's going on.
Joe, anything you want to add there? 6 feet, mask, stay at home. What do you think?
It's all about layering. It's all about layering those protective factors. So I don't think I'd add anything else to that. But I really do appreciate, that we all have to be cognizant of what's going on with ourselves. And so I've had multiple conversations with people to say, I'm sniffling, I have a sore throat. Well, I typically do get allergies around this time of year. So that's great advice when we talk about just be aware of it. Be aware of it and and always err on the side of caution now. So if you think about, well, it's probably allergies, but I want to go to work anyways, maybe not. Maybe try to take an extra day if you can. Maybe try to stay home from school if you can, and see how it
And
progresses.
at the very least, stay the hell away from me. If you got something, if you're sneezing or whatever, don't come trying to shake my hand or talk to me and spread. Don't do that. Okay. Just say, like wave from a distance or something.
And,
Um,
and I always tell people, ask yourself, is wherever you're trying to go, is it worth potentially giving whatever you have? It might not be COVID,
mhm.
it might just be a cold, but is it worth giving it to somebody else? So if you're having, some mild symptoms that you believe are allergies, and you're expected to go to a wedding, and you know that you're going to be close
Yeah.
to people, you're going to be sitting at a table with others you might not know without a mask eating, yeah, it's a great occasion and you want to be there for your friend, but do you want to be known as giving COVID-19 as your wedding present? No.
Yeah.
Or giving a
Mhm.
cold or the flu. So, really ask the question, is what I'm dealing with worth the risk that I could expose to others? It could be nothing, but what if it is something?
I totally agree. I mean, yeah, I was at the grocery store yesterday, and I decided I was like, what, I'm gonna really try to just cook more because I just want to be out less. I think, I want to try to start minimizing my um, uh, exposure, if you will, and so I bought more groceries. I thought, I am dealing with the COVID-15 that some of us have had to partake in. My jacket's a little snug here today, but and so I'm trying to eat a little, cook a little more at home, just not be out as much, and I think we all just need to. It is okay to patronize your restaurants and do some of these things that you have to eat. You have to do some things, but I think your point's right, and that's make the good judgment call, and like I said, I know I'm in the store and you hear somebody sneeze or cough and it's like, oh, I got to get the hell out of here because or I'm not trying to walk through the plume of sneeze that just occurred a few feet away, and I think that's the kind of the environment we live in. I'd be remiss. I mean, we got to talk a little bit about race relations, and um, I think the George Floyd, while tragic in its situation, the perhaps silver lining in his death, or perhaps that he didn't die in vain, is the conversation of race in America today. And yeah, it's zeroed in on law enforcement in that environment. That's a topic in itself. But let's talk about it from the standpoint of public health. Talk about the disparities that you see in race, and what can we do to get at some of those disparities. I mean, we know that I mentioned earlier, hypertension, diabetes, high cholesterol, all of these things are potentially preventative if you manage your wellness and health better. But talk about it from a public health standpoint. I mean, what are there racial implications, or is that not something that we see in public health? Who wants to go first?
I'll go.
Okay.
So obviously, yes, all of those diseases you mentioned, and I hope you listed diabetes in there. We know African Americans are disproportionately affected by that. So we have more African Americans that suffer from diabetes, that suffer from hypertension, suffer from heart disease and lung disease than we have Caucasians. We also have many more African Americans who die as a result of complications from those diseases than Caucasians. So why is that? It's complicated. We could list a number of different things: access to healthy food, access to a provider that treats you appropriately. Again, going back to the cultural competence, appropriate housing so that you can reduce your stress levels, safe housing, affordable housing, jobs. When you have a job, usually when you have a job, you get what? Healthcare benefits that cover the cost of that doctor and those prescriptions. So there are a number of things. And again, it just brings back to what I said early on, our values. This pandemic has disproportionately affected people of color. We have seen that. And some people say, well, why? Early on, there was some elected official, and I won't say their name, and actually I don't even remember their name, but they questioned, well, do Black and brown people just not wash their hands? Is that why more Black and brown people?
That would be Senator Huffman. Senator Huffman, Huffman. That's Huffman, Senator Huffman.
You said that, Commissioner Boyce.
I did. I said it. That's right.
Yeah. So that's not the issue, though. It has nothing to do with hygiene of Black and brown people. Let's all think about this. Back in March, at least for Ohio, our governor told everyone they needed to stay home and they needed to remote into work. If I'm a COTA bus driver, if I work at McDonald's, if I work at your neighborhood pizza parlor, is there any such thing as remoting in? That's a luxury that is given to white collar workers that many individuals do not have the benefit of partaking in. If you work in the hospital setting, whether you're the food service person or the janitorial staff, you couldn't work remotely. So what happened? Those individuals were going into their workplaces on a daily basis to provide needed services that we all wanted and needed. And
I need my pizza. I mean, I got to have pizza at least once a week. So you're absolutely right. That's part of the problem with this COVID-19 15 that I've gained.
Those individuals were going to work, and if you weren't a healthcare provider, you weren't wearing PPE.
Right.
We weren't telling people to wear masks then.
Remember, there was a point where you were saying, don't wear the PPE because we need it for our healthcare providers.
Absolutely, which is a whole nother issue, but we won't go there. But those individuals were put in situations because of their job that those individuals with white collar jobs didn't have to be placed in. And many of those frontline workers were Black and brown people. And so that's why we saw that early disparity. And then when we see the disparity with hospitalizations, it's because of their health today, whether it's the stresses in their life. We've seen families, at least in our jurisdiction, where there's 8 people living in one house, 2 bedrooms, 2 baths. One person gets COVID-19, the whole household's going to get it, because how do you isolate? How do you quarantine in a location like that? Versus we've seen other individuals living in a 3,000 square foot house with 4 individuals, and the sick person is now in the basement with their own bedroom, their own little mini kitchen, and their own bathroom. But not everyone lives that way. Not everyone can afford that. And those on the lower end of our income spectrum were disproportionately affected, largely because of their living conditions. And so again, it just talks about our values and how this disease has disproportionately affected the haves and the have-nots.
Yeah. Joe, anything to add there?
Well, I would just, I would agree absolutely with everything Dr. Roberts just said. From our standpoint, what we've been focused on at the health department is we have one goal at Franklin County Public Health, and that's this idea around equity, that we have to incorporate equity into everything that we do in public health. So whether that's the services that we provide, the programs that we deliver, how we, put our resources. I mean, it all comes down to this idea of equity. And what we've seen in our previous community health assessments of these significant disparities by race, and they are right there, and we have to do more to address them. In order to do that, you got to go upstream. You got to tackle those social determinants. A lot of what Dr. Roberts just talked about, but then you got to go even further. And that's where the racism declaration comes into play, talking about what are the systems and the policies and practices that have led and contributed to those conditions that we see, the unaffordable housing, the public safety concerns. I mean, all of these things are connected, and we have to go as far upstream as possible to impact the policies that ultimately give our residents opportunities to be as healthy as possible. So we do have disparities in hypertension and diabetes and obesity, and it's complicated, just like Dr. Roberts talked about. But that's why we have a community health improvement plan that brings organizations that are addressing those social determinants together to talk about, okay, how does the work in our housing sector impact the work of our education sector? Why is kindergarten readiness so important in our community? Because it ultimately is going to affect an individual's health. So why is poverty so important? Why is the Rise Together initiative so important? Because poverty is an indicator for health status. And so it's all connected. And we have, amazing collaboration and partnership here in Franklin County. We have a lot of work to do in that regard. And we see these health disparities right in front of us because of COVID-19.
Yeah, I've often said that I think the greatest equalizer is economic mobility. I mean, the best social service is a good paying job. And I think the way you line that up, Dr. Roberts, and you too, Joe, I mean, I really think that in the Rise Together, which is our poverty blueprint or blueprint to reduce poverty and racism that the county has adopted and spent over a year developing, what the core element of that is helping get those families that you described, Dr. Roberts, that live in that 2-bedroom, apartment, and there's 8 of them, helping to get that family to the next rung of economic stability and ultimately sustainability. It's great that we can provide a rent subsidy or a food subsidy or things, but it's better when we can provide them with the resources to earn more, the resources to live in a more appropriate environment and setting for their families. And so, I mean, we've got some real work to do. Let me just, we've got about 3 minutes here. And the one thing I maybe close out on is the idea of where we go after COVID-19. Hopefully soon there'll be a vaccine. How much, I know for myself, I have just developed the practice of washing my hands much better and more thoroughly. I've always washed my hands, I'll say that. And I know, because I've been in the restaurant with some people who don't wash their hands just coming out, but hey, that's going to change. But I do, but now I'm more thorough. I take the time to really wash my hands and allow the water to get hot and to really sort of, and almost to the point where I probably use gallons of lotion this year just because of the ashiness of my hands from washing them so much. But we also are thinking of different things. Like, when I clean my kitchen now, I wipe the door handles down and I wipe the light switches down. And those things I didn't really think about before, or if I have guests, I have them take off their shoes the minute they enter my home and they're in a tray, and then I spray the tray later. I mean, there are just, I think, hygienic things that are changed. How much of these practices do you think will exist beyond this? So we got 2 minutes, so we got to be short, but how much of these practices should exist and will exist post COVID-19?
I think many of them will. I think the handshake that we were also accustomed to when we greeted people, I think that's really going to be a thing of the past. We're no longer going to be shaking hands. We're still going to be washing our hands.
We do the elbow bump now.
We can do the elbow bump. Yeah, we're going to do I've heard people do the foot kick.
The kid and play foot kick. Yeah, absolutely. Yeah.
So I think a lot of this is going to be around for a while. I liken, my word of unforgettable is I think about experiences in my life that have really changed me. And, I likened all of this to 9/11 and think about how travel is so different now after
Yeah.
9/11. So I think when we look back on 2020, from in 2024 and beyond, we're going to say, oh, we started doing that during the pandemic and we're still doing that.
Yeah. Joe, what about you? This
You know,
continue? Will this continue?
I think so. I think we have relearned a lot of things that we always sort of took for granted, but maybe didn't think a lot about. And I think you gave some great examples there. So I think when this is all over, as we get into 2021, I think we will certainly sort of go about our daily life a little bit more mindful of our connectivity, whether it's communicable disease or otherwise. And so, if we have better personal hygiene practices, that's a good thing for public health. But
For
I think that
all.
I think the bigger point though is that we are all connected. That as a community, this pandemic has reminded us of that, and that we certainly need to keep that in front of us as we move forward. So.
Man, well, thank you both. While this certainly wasn't unexpected, it definitely is not going to be unforgettable. I really appreciate you guys for joining me today. I think that your leadership has been exceptional in this process and in a very difficult environment. Ken Wilson wrote in and says, thank you to both of your leadership. You're great partners for Franklin County and Columbus Health Departments. And that was from Ken Wilson, our county administrator. And I join him in saying that. I also want to say on behalf of my colleagues, Marilyn Brown and John O'Grady, thank you for watching. Thank you for the conversation. It's a brotherly, and in your case, Dr. Roberts, sisterly conversation.
Thank you for letting me join the club.
Absolutely, absolutely. It's been great. And we've got a great show scheduled for next week, everyone. Guess who I'm having on? Congresswoman Joyce Beatty and City Council President Shannon Hardin. Now, you all saw those iconic pictures of us being pepper sprayed earlier this summer out at the protests. And so we've got a lot to share with you, a lot to share with you. I'm very close to the both of them. We talk all the time, and I think we're just gonna put it all out there. So if you want to hear some stuff, tune in same time next week, 3:00. With that, I just want to say thank you so much for joining me, to my special guest. Again, stay strong. I hope that you two are doing things for your own mental health. I know you've got to be immersed in the challenges that we face as a community, but we are all supporting you. We are all rooting for you, and we all are counting on you to help bring us home in this pandemic. You are our leaders, you are our guiders, and we appreciate and value, but we hope you're taking care of yourselves. So thank you so much for joining us. It's been a great brotherly and sisterly conversation with your favorite county commissioner about health, wealth, and race in Franklin County in Central Ohio. Until this time next week, Wednesday, 3:00. I'll see you soon. Stay safe. Take care. Bye, everybody.